Let's begin the discussion with experts from around the world. The coronavirus outbreak has so far caused a massive impact in China, Central and Southern Europe, and the United States. Countries in Latin America and Africa, though, they've generally received less global attention as they've so far experienced fewer infections. But now they are starting to see their numbers grow. If the pandemic spirals out of control in these countries, experts are warning that it could be catastrophic. Today, we connect with Dr. Osman Dar, Director of the One Health project at the Chatham House in the UK, who was recently in Zambia, and Manuela Parrino, a journalist based in Brazil. Now, first, let's start with you, Manuela. Most governments are urging the public to stay indoors, practice social distancing, and go to work only if necessary. But in Brazil's case, it seems that your president is doing quite the opposite. And of course, he's been the subject of much international criticism. But within Brazil, how is the COVID-19 situation and how has it impacted daily life?
Yeah, well, Brazil is a very big country. It's the biggest country in South America, and with over 200 million people, where the richest 5% have the same income as the remaining 95%, and where 16 million Brazilians live below the poverty line, and where wealthy families are used to have 4 or 5 people working in their houses, and they're not willing to give them up. So in this situation, a large part of the population doesn't have the luxury to stay home. They cannot afford not to be paid. And we also need to remember that Brazil is a confederation of states. And in a situation of emergency, the governors have the authority to impose their own regulation. So each state right now is reacting in a different way. São Paulo and Rio de Janeiro, 2 of the richest states, have asked people to stay home. Schools are closed in almost all the states. But only private schools are able to offer distant learning classes, and this is creating a chaos. Malls, shops, cinema, and restaurants are closed in many states, but we're not seeing the level of restrictions that have been implemented in many European countries and part of the United States. People with low income and small businesses are struggling to survive, so lots of people are still going outside. Yes, traffic is light and buses are half empty, but life has not stopped completely.
As you just said, it's very unfortunate that it's often the lower income workers and also those under the poverty line that are the hardest hit by pandemics like these. And well, Dr. Dar, the number of infections and deaths in African countries are also quite fluid, as in the number of cases. And you were actually in Zambia in March earlier last month, training medical officials and personnel from the African Union, which represents 46 states on the continent. How are the health authorities bracing themselves over there? Is there enough testing going on in these countries, and are they ready to deal with a sudden surge in cases?
Well, thank you for your question. So the African Union actually represents 55 member states in Africa, and 39 out of the 55 are now reporting disease, with 23 of the countries having some local transmission. Only South Africa and Algeria at the moment have more than 500 cases. The rest have less. So most of the countries have imported cases or don't have cases at all as yet. Now, the good thing about Africa is that Africa is better than it has ever been before. I think the experience of Africa was a real wake-up call to leaders in the region and in the world, and so a lot of investment and thinking has been put into building Africa's capacity since then. The Africa CDC was established, and the Africa WHO Afro region developed 2 sub-regional hubs for emergencies, and the World Bank and countries themselves have put in a lot of investment. And so that's why when this outbreak first happened, Africa WHO and Africa CDC scrambled very quickly to start training and capacity building in the Africa region. And so we've had IPC, infection prevention control training, we've had surveillance training. The training I was involved in was around points of entry and clinical case management. So lots of the African countries have been getting prepared in the build-up to the virus coming into Africa.
Well, I'm afraid we experienced a bit of a lag there in terms of the connection. But in terms of what you just said, African countries, they have been preparing for this. They've been undergoing training and also investing in some facilities, receiving aid from some international organisations too, of course, and consultants like yourself. Well, Manuela, leadership really is very important in times of crisis like these. And, well, Facebook and Twitter actually removed posts by your president after he claimed that some medical substances are working against COVID-19. And he also called for an end to social distancing. But at the regional level, officials are trying to take more stringent measures to curb the spread. How are the people of Brazil reacting to these mixed signals?
Well, yeah, as you were saying, there's lots of confusion here. Recently, all 27 governors met in a teleconference without President Bolsonaro, and 25 of them decided to ignore Bolsonaro's instructions and to continue the lockdowns. The two biggest governors now leading this kind of fight against Bolsonaro in the media are two right-wing governors that were the president's two biggest allies. And right now they're fighting him openly. Bolsonaro issued a presidential decree enabling churches to reopen, mainly referring to evangelical churches that are almost 30% of the population and the core of his supporters. And basically, he sent a green light to the evangelical people by saying that everything is fine and that all the doctors and public health officials and people like that are just lying, that Brazilians are very special and strong people and this virus will not attack them. He left the quarantine to go outside and hug and handshake people's hands during the street protests. And in doing so, he's losing the core of his constituency. The two biggest papers in Brazil ran an editorial this week saying that it was time for him to resign. And there have been nightly protests in the middle-class neighborhood for the last 10 nights in a row, where everyone comes out on their balconies and bangs pots and pans and yell out with Bolsonaro. The only people that are still supporting him, seemingly, are the evangelical Christians and the oligarch that had him elected.
A lot of confusion and fear in Brazil due to the mixed signals coming from officials in response to the COVID-19. And while I heard it's got a quite fragile healthcare system as well. And well, Dr. Dar, I mean, what do you think about this? I mean, in countries like those in South America, where the public health system is already quite precarious, or countries like Botswana in Africa, where 1 in 4 people are HIV positive, how would the surge of COVID-19 complicate or worsen challenges to public health?
So certainly countries with more fragile systems, healthcare systems like those that are in conflict in Africa, the DRC, the Central African Republic, South Sudan, Somalia, we certainly need to worry about those, because those do have fragile systems. And of course, there are big infectious disease killers as well in Africa: tuberculosis, HIV, and malaria. So in Africa, it's very important that the rest of the health system is protected while a lot of resources are being diverted towards COVID-19. And I think what was really good about the training that we did in Zambia was that local physicians understood this, and they understand that there's a balance that needs to be struck between responding to this outbreak and managing everything else that Africa is already challenged with. And WHO has released very good guidance now on health systems resilience, so how to maintain essential health services while you're trying to deal with COVID-19. So Africa is conscious and aware of these issues, and they're drawing on resources and partners from around the world to support them in keeping that health system resilience going. Because you're right, it's a key thing, balancing the challenge of COVID-19 with already strained health resources.
Well, Manuela, what about the medical system in Brazil? Does it have the capacity to deal with the rising numbers, possibly hundreds of thousands, if infections surge in the country?
Well, Brazil was one of the best countries in the world in responding to the AIDS pandemic. So they do know how to handle pandemics. The problem is that, as pointed out by the Brazilian Ministry of Health, that if the country doesn't take proper precaution to stop the surge of the virus, the healthcare system will collapse. The risk here is that the virus, which has already reached the most poor and vulnerable areas, will spread at a speed that is out of control. The public system that serves 80% of the Brazilian population does not have the means to curb and a collapse will increase preventable mortalities. And so again, we're going to see a war between rich and poor. This is a virus that was imported by the wealthy in Brazil and is now reaching into the impoverished communities. Rio's first death was a maid who is believed to have caught it from her employer that had just came back from a trip to France. And the virus has left many of Brazilian 6 million domestic workers with an impossible choice, like either their job or their health. And the numbers that we have today are not giving us the image of what's really happening in the country because of lack of testing. According to Margaret Dalcomo, is a pneumologist working at Fundação Oswaldo Cruz, one of the world's most respected tropical disease and public health research institution, said that the over 4,000 official current cases represent around 10% of the number of infected people. And so we are definitely looking at a surge of numbers and death in the following week, unfortunately.
And as you just said, one of the worst consequences really would be, the increase of inequality, and it's just very unfortunate news.
Yes.
And well, we're running out of time, so let's finish with you, Dr. Dar. What are the dangers of this virus spiking on the African continent and also in Central and South American countries, while we see cases in other countries peaking and subsiding? How would the rise in cases in these continents impact the world?
We all live in a global community now, and we're only as strong as our weakest links. And that's why it's really critical that we support those countries that have the weakest and most fragile health systems. And so, one of the big lessons from this outbreak will be that we really do need to address this issue of inequalities, global inequalities, and particularly inequalities in poorer parts of the world, like Africa, in order to protect all of us. I think those are going to be the sort of key lessons that we must learn. I think all regions need to be able to develop their own capacities, because you can see that there is what we're calling viral protectionism that's taking place now across the world. Even very wealthy countries are all fighting with each other. They're scrambling to get, diagnostics, ventilators, critical care equipment for themselves, and that means that inequalities and inequity widens even more. So Africa does need to be able to develop its own capacities and manufacture them, and the same goes for vaccines, and the same applies to South America. Every global region should have its own capacity to develop diagnostics, manufacture them, and also the other countermeasures that are required. And we're going to have a lot of solidarity across the world after this in order to be able to make everyone able to do that. I think a lot of big institutions have roles to play. The World Bank and the IMF should increase their investments into African countries. Part of the reason African healthcare is so weak is because in the 70s and 80s, the World Bank and the IMF insisted on structural adjustment programs, which made African countries have to cut their public financing of the health system. So all this stuff needs to be looked at again, so that we have well-funded health systems across Africa and across Latin America too.
Right, well, I'm afraid we're out of time there, but as you just said, international cooperation is needed to help these countries who have very weak healthcare systems respond properly to this crisis. Well, thank you so much, Dr. Osman Dar and Manuela Parrino, for joining us all the way from London and Rio de Janeiro.
Thank you for having me.
Thank you.
Well, this is also where we end the show. Thank you for watching, and we hope you join us at the same time tomorrow for more global insights on issues making headlines. Have a great day wherever you are. Goodbye.